we offer non-incision pinnaplasty. I'm sure I spoke about this the other day. I feel like I did anyway, but whatever. I'll talk about it again. No, we don't. So non-incision pinnaplasty is basically using a splint. So pinnaplasty is changing the shape of the ear, also known as prominent ear correction for people who have got prominent ears. And it is possible to correct a prominent ear without using surgery, by using a splint to splint the ear back and then holding it back. The problem with it is, because that sounds good, doesn't it? Avoiding surgery. We all want to avoid surgery if we can. Yeah, you heard me. We all do. I would avoid surgery, even though I'm a surgeon. I'm sure they'll always find things for me to do. But if something can be done without surgery, without risk, without complications, let's do it. I'm all for it. But we don't do it because it only really works in newborns. So in very young children, the cartilage of the ear is still quite supple, and so you can correct a prominent ear with a splint. There used to, I don't know if this still exists, a thing called an ear buddy, which was made by David Galt, who was a very well-known still is a very well-known plastic surgeon specializing in ears. And the ear buddy was a thing that you would put on, but it really needs people like midwives and people like that to be kind of aware of it. It's quite a difficult subject, I would imagine, to bring up with a newborn, but the sooner you put it on, the better, because as soon as you start getting old, even with a year or so, the cartilage becomes a lot more firm and is not able to be molded with the ear buddy. So we don't do it simply because it's only really appropriate for newborns. So that's why it's not really effective in adults. Adults can't really correct a prominent ear without surgery. So that's why we don't